Yeah, good afternoon, good evening, good morning. Thank you for joining the webinar, fifth webinar on scaling up service delivery in urban settings. We'll wait few more minutes for other colleagues to join in. But in the meantime, just as housekeeping rule, if you have any question, comment, please use the chat function. And there is interpretation in Spanish available. So if you want to use the Spanish channel, you can choose the Spanish channel. We can start. Good afternoon, good evening, good morning. Thank you very much for joining the fifth webinar series on scaling up sanitation services in urban setting. This is as a follow-up of Global Sanitation Summit, which was held in Nepal, where different stakeholders joined together in last June, which was hosted by UNICEF and WHO WaterAid with the technical support from SNV and other partners. It had brought delegates from about 25 countries where they shared their efforts towards SDG 6, safely managed sanitation targets, and discussed common as well as context-specific challenges and came up with action points. Uh, During the event, there was a lot of exchange and it was so rich and valuable, but the learning was limited to whoever were present. So this webinar is a follow-up of that Global Sanitation Summit where it was discussed and agreed that we will continue the discussion. And this is the fifth series. And today we will have introductory presentation by Antoinette Kome, then followed by two cases, one from Uganda by Dr. Felix, and another case by Julio López from Bolivia. So just to give a background on what these steps or the framework are, we know that we need to dramatically accelerate the progress on sanitation, and that better sector alignment and coordination is needed more than ever to make the acceleration. At the same time, we also know that there are still major gaps in understanding on what safely managed sanitation or climate resilient sanitation mean, how to integrate safely managed sanitation in national policies, plans, regulations, standards, and implementation. So this framework, which was developed, is nothing new, but designed as a sort of checklist to help demystify some of the questions and navigate through the existing guidelines and tools. So I'm not going to go in details of this framework, but you can have access to this through Susanna website. This framework is expected to support country teams to work together at national or subnational level in setting up the common goals and implementing the government-led roadmap strategy in complementary manner across partners and stakeholders. With this, I would like to invite Ms. Antoinette Kome. She is the global sector head, outgoing global sector head of water in SNV. She has been in the sector for more than 25 years, and she has been working on water, sanitation, hygiene, irrigation, water resource management, all across the world. And she has been guiding and supporting in order to develop the SNB water sector, and also been very influential in terms of overall water sector. Now, I would like to request Antoinette to present the framing presentation.
All right. Thank you very much, Rajeev. And thank you everybody for joining the webinar. Bienvenidos los que vienen de América Latina. Es un gran gusto. It's a big pleasure for me to be able to present
Latin America.
This topic on urban sanitation. We were all together in Kathmandu for the Sanitation Summit, and I think it's great that we can share this inspiring information to a broader audience. So let me see if I can move the slide. Yes. All right. So there's a delay in it. So we all know that the world is facing unprecedented urban growth. We are becoming an urban planet very, very fast, and it is overwhelming. And in some cases, cities and towns are growing much faster than even services can expand. So when we look at these data here below, I'm not sure if you can see my mouse, but the data from the JMP on the urban service levels from 2015 to 2022, you see there's a small improvement, and that is encouraging because the population in urban areas has increased, and in spite of that, safely managed sanitation has slightly improved as well. But of course, the challenge is still big. There's a third of the world who does in urban areas who does not have access to safely managed sanitation. And you see in the upper right part that a lot of these people live in sub-Saharan Africa. A number live also in Central and South Asia. And when you look at the data below, which comes not from JMP, but from SNV, these are city data. You see also there's a big variation among cities. So we do still have quite some work to do. And why is urban sanitation so much more complex, so much more a sticky issue than maybe in rural areas, not underestimating the rural challenge there? First of all, in urban areas, of course, you have this diversity of people. You have people coming from all regions of the country, from different religions, people who have larger houses, smaller houses, informal settlements. That is much more diverse than what is than the people in communities. also we have a diversity of toilets and containment under those toilets. I guess if you are working in sanitation, you've all experienced that a septic tank can look very different in different places, and people call it a septic tank, but it may be something more as a pit or a twin pit or something else. And also in urban areas, you see this mixture of waste. You see solid waste and sanitation mixed, going together in drains. You see how sanitation interfaces with other sectors very much, with housing, for example, and urban planning, but also with roads and drains. And this all affects how we are able to manage sanitation. Unfortunately, currently, sanitation is creating a lot of pollution in our urban areas. And that bad sanitation is really affecting the poorest people, who are more dependent on their public space and more dependent on those public water bodies. We also see high density of population, some cities more than others. We see sanitation workers, groups of people who specifically work in sanitation, for example, to unblock your sewer or to empty your septic tank. And their working conditions are often not very good, both in terms of how they need to work, but also health insurance, all the health and safety, or even the recognition and the payment for them. And then urban sanitation requires large infrastructure investments. But it is incredible how many of these investments around the world are not used. I can give you examples of countries that I visited where less than 10% of the fecal sludge treatment plants are currently in use. Urban areas are also complex in terms of regulatory setting, because it's not one entity which is responsible. There may be a utility which is responsible for the sewer part, and then there may be a municipality responsible for the non-sewered, the on-site sanitation, and there may be an infrastructure authority who is responsible for investment. So there's always different entities involved. And last but not least, urban context is generating a lot of pollution from sanitation, but also from solid waste and the runoff. And that is really affecting our ability on many fronts, for drinking water, but also for other uses, and of course for the environment. So we have this urban context, and it's a big challenge. Now, of course, this is not new to you. And you're asking me, if you're telling me a story that I already know for so many years, why aren't we making more progress? Why aren't we there yet? Well, first of all, what I want us to reflect upon is the fragmented investment that we see. We don't see more strategic, comprehensive investment in urban sanitation. Even if cities take the initiative and make a city sanitation plan, it doesn't always mean there is investment. Because to address urban sanitation with all the capital expenditure and the different activities it requires a more comprehensive investment package coming from the national level. Secondly, often when there is investment, there is a tendency to focus on sewer for the center of the city, which will help the image of the city and the city look good. But it also means that the needs of more marginalized groups who live in peri-urban areas, informal settlements, are not considered. And sewer is incredibly expensive. And then there is the issue of behavior change. Sanitation requires a mindset shift at many different levels, but also within the different nodes of the sanitation chain, going from toilets, transport, conveyance to treatment, the whole regulation. It requires another way of thinking. And still, too many people think sanitation is just an engineering problem. But if we don't change the way people behave in different nodes, and the way also populations behave around sanitation, we will not solve the sanitation problem. And part of that is that it's often left to households to manage when it is non-sewered sanitation. So in that case, I've seen in so many countries, there's toilets, and those toilets drain directly to either the waterway or the drainage. And lastly, because there's different entities involved, sanitation is complex, it needs better coordination between responsible authorities. And that's not always easy. I guess we all know that. I'm trying to go to the next slide. Yes. So lately we've been talking about citywide sanitation, and I want us to take a moment to think, what does citywide sanitation really means? First of all, it means looking at the entire sanitation value chain. So not just at people having toilets, but the entire chain, so that sanitation is safely managed, so that there is sustainable separation of human excreta from human contact. If we just have a toilet and we dump the contents in the drain and children play in those drains, or those drains flow to other areas where people live, then we don't separate human feces from human contact. Secondly, safely managed citywide sanitation means that we spatially reach all parts of the city, not just the city center, and that we reach all social classes in the city. Those who are house owners, but also those who are tenants or who are informal. So practically, what does it mean to organize citywide? If we consider the sanitation chain here on top, maybe the city center has sewer. Maybe the low-income areas have households with septic tanks and private emptiers bringing it to a transfer station where city trucks then take the sludge to a treatment plant. And maybe there are other areas with decentralized wastewater treatment, where households have a DWATS committee, which in certain intervals is emptied by city trucks and goes to the treatment. And maybe there's other areas with markets, with public toilets, and there could be areas with communal toilets and households who are directly emptied by private trucks. So in order to organize and reach the whole city, we actually need quite a number of models, especially in the bigger cities. And all these different models, the treatment plant, the city trucks, the public toilet management, but also the private emptier, need to be financially healthy services. At least they need to have sufficient revenues to continue operating, and preferably also to reinvest. Now, sanitation service delivery, to achieve that, we need changes at many different levels. So we need changes in policies, standards, regulation, finance, data, and of course we need the necessary innovation. And one approach to do this is citywide inclusive sanitation. So that aims to scale safely managed sanitation across the city. It recognizes that sanitation is a public service approach, because governments are duty bearers of the human right to sanitation. So maybe they will not do everything themselves, but they do have the obligation to make sure that everybody has access. CWISE looks at appropriate systems at different scales along the entire chain, and also aims to solve problems through data and evidence, and thereby gradually make progress. Famous or more known is maybe the 2x3 CWISE framework, with the CWISE outcomes and functions. The outcomes are three main elements of sustainable services. First of all, that the services are equitable. It means that they're fair, that everybody has access to service at a basic quality, at an accessible price, and with a fair level of subsidy. Also safety, that it is access to safe sanitation and that it's access to sustainable sanitation. From the perspective, I've I will wrap up quickly, Laura. Sustainability, both financially and environmentally. And we want to achieve this through C-wise functions being responsible, improving responsibility, accountability, and resource planning. So how do we scale, and this is my last slide, how do we scale from citywide to nationwide? To do that, we need to be clear which models are appropriate for the country, and so what could we want to scale in terms of safety managed sanitation units. But also, who would be leading and who would be supporting that scaling, and how fast can we go in function of the money and in function of the people and the capacity we have in the country. When we're scaling, it's not just about doing more of the same, horizontal scaling. It's also about institutionalizing those changes and making sure that the enabling environment is set up for that new way of working in urban sanitation. And of course, there will be specific environments, maybe flooding environments or remote environments, that require further adjustments in what the model of urban sanitation is. So the most important message is that we need to prioritize safely managed sanitation, and that we need to be intentional how we scale this citywide and also how we scale it at the country level. Thank you very much.
Thank you very much, Antoinette, for setting the scene and also sharing the challenges for scaling urban sanitation services, and also stressing that we need to prioritize and have intentional focus for scaling of the services. As we have very limited time, I would like to request everyone, if you have any comments, queries, please use the chat function. Now, we will have our country cases. The first case will be presented by Dr. Felix Twinomucunguzi, who is the Assistant Commissioner in Ministry of Water and Environment in Uganda. Felix, over to you.
Thank you, Rajeev, and thank you, Antoinette. You're all welcome to this webinar. Thank you for the coordination. As I've been introduced, I'm Felix, in charge of urban sanitation, coordinating urban sanitation at the Ministry of Water and Environment in Uganda. And I'm pleased and happy to share briefly our experiences that we may be having in Uganda. And yeah, Antoinette has really done good service. If we are in courts of law, my presentation would only say guilty as charged, and we close the case. Because the case that we're going to present for Uganda shows really the multitude of most of the challenges that Antoinette summarized, which seem to affect many or all cities or urban areas in the developing world. We are about 45 million people in Uganda, and a quarter of the population resides in what we call urban areas, or gazetted urban areas. And of course, worryingly, close to half of this population living in all these urban areas, all of them resident in informal settlements, or what we call slums. And we all know what comes with that discussion. Being informal means that it's outside the national regulations, it's anybody's business. And so service provision in these areas has been left behind, and which is creating a situation of really poor sanitation, access to safely managed sanitation. The sewer coverage in the country is still, again, very poor. Less than 10% of the people have access to the sewer sanitation, which have been trying to promote as the main sanitation approach in urban areas, but this is not taking us far. Since the 1960s, we are now at 10%. We still have about 10% of people practicing open defecation. These are sad statistics. And most of the people use at least some form of pit latrines. But the worrying bit is that most of these pit latrines do not have adequate substructures or line substructures which can easily be emptyable. So they are still difficult. The majority of them are just open pits in the ground with limited access. The worrying bit of this curve that shows here is that we are still way off in achieving what we targeted for the sustainable development goals of, all inclusive, that everybody in urban areas has access to self-reliant sanitation, which would be 100%, but we are hovering at close to 40% in these statistics. And the historical performance over the last 5-6 years does not show that we are anywhere close to reaching this all-inclusive approach. So we thank this initiative and more initiatives that we discuss in Kathmandu, and what needs to be more. There's a lot to be done to kickstart or jumpstart all urban areas in the developing world, or maybe begin to take these experiences and lessons in trying to define what we can do better, maybe post the 2030, because at this rate, we are really pessimistic that we shall get anywhere close to even 80% or so. But we keep trying, curious, and trying to hope that we can learn lessons from all over the globe and try to see what we can be able to achieve. So what have we done in Uganda? Next slide. We can see that with respect to just citywide inclusive sanitation, where we try to make sure everybody is part of these sanitation approaches. I'll try to discuss this from a 3-point perspective with the Kampala City Council, which is the main city, and then the small towns aspects, and what we are doing at the ministry level to improve the neighboring environment. I'll start with the Kampala city is the main city in Uganda, mainly with about 4 million residents. Same situation with more than half of people living in what you call the informal settlements. So towards start of about 2018, 2017, there with support from the Gates Foundation and other partners, we try to do a lot of activities to improve, make sure that everybody is considered and inclusive in the support for sanitation services. All these on-site facilities were mapped into the areas digitally. We set up sort of a call center that if they need emptying or need any form of support, they can be able to call this kind of support. And interestingly, the City Council has coordinated what we call scheduled emptying services, where we go, say, make announcements, this informal settlement, in this week, 5 days, there will be services for emptying at subsidized rates. So then we can be able to empty as many pits as possible in this area. And we've been collaborating with the private sector to try to implement this. And all this was put into what we call the Kampala City Council Authority Sanitation Ordinance, which was enacted in 2019, which was the first really sort of legislation at the city council level, trying to look at sanitation, which is the on-site sanitation. As I mentioned, if you look at the legal framework currently, you talk about in Uganda, if you talk about urban sanitation, you're only talking about sewage and networks. But as I mentioned from the beginning, you're only talking about 10% or less than 10% of the population. So you have 90% of people that you're actually not talking about. So this is a first sort of legislation at the municipal level that we begin now to talk about non-sewage sanitation. And we are supporting this initiative at the national level, the Ministry of Water and Environment and Ministry of Health, trying to work together to set what we call minimum standards in these urban areas, which can be good and emptyable, trying to build capacity of the stakeholders, the municipalities, the local governments, the private sector, in different aspects of the non-sewage sanitation, trying to bring all stakeholders together. And we have had some several coordination meetings and sharing information about this, the talk about non-sewage sanitation, trying to promote, mobilize resources from the World Bank, African Development Bank, and other partners who can be able to support these areas. And of course, we're also having an eye at a bit of how can we strengthen the regulation aspects. It's always a difficult to talk about regulation when, again, the access levels are still very poor and there's still a lot to be done. But it is still better, so that the regulation can develop along with the other aspects. Now, learning from these examples that we had in the Kampala city, we have also been trying to do similarly experimenting in what we call the small towns category, scaling this up into the small towns which cover the entire part of the country. And these are towns mainly with populations maybe 20 to 30,000 people, compared to Kampala, which was 4 million people. So these small towns, the services, the population is much smaller. Consider the demand, for example, for emptying is a little much smaller in each town. So we came up with an approach that we call demand aggregation, or clustering, where we put about 5 or 6 town councils or these small towns together to do an integrated town sanitation planning approach. We know that, yes, we have, for example, a fecal sludge treatment plant in town X, which can be served all the neighboring towns, and we all work together to manage this plant well, and also what other incentives that we can do to the households to improve their sanitation. We are procuring sort of cesspool trucks using public resources and sharing these trucks to a leasing model with the private sector, and encourage them to go to these cluster areas, which are a little bit out of town and with low service coverage, but they can be able to provide service at a slightly subsidized rates, which is still working. And as I mentioned, most of the households have pits that are unlined. So we're trying to explore financial incentives, maybe through soft loans with banks that we're cooperating with, provide this kind of soft loans to people that they can be able to build improved sanitation facilities. And we have a strong focus on institutions, schools, health centers for the population that is available there, but also that these are good hubs for sharing information with the rest of the population to see that what can be done with not only sewage as the ultimate sanitation, but also favorable on-site facilities can be good sanitation aspect. What has worked in the occasions, as discussed, I think we are really proud of what Kampala Capital City Authority has been able to achieve. This authority that is autonomous has planning and legal resource mobilization and implementation capacity. It has better capacity than all other local governments. And it has been able to really collaborate with the minimal support they have, collaborate with the ministry, the utility, the National Water and Sewage Corporation, bring civil society, players like Water for People, GIZ, all have come together to participate in this non-sewer sanitation approach in the city, and collaborate a private sector. All of them are licensed and is coordinated together at the City Council Authority. And this has been really very helpful. So when city is large and has high technical capacity, can be able to coordinate and collaborate all stakeholders to manage some of these non-sewer sanitation aspects. As I mentioned, on the smaller towns aspect, their support of the central government has been very critical, providing such seed infrastructure like trucks, which can be managed at the local level. And the capacity and the project are still small, that they still need public support through the central government to be able to bring the sanitation services off-site to a good standard. Next. So the key challenges still outlying that, again, I mentioned, the infrastructure is still poor, unlined pits, the limited sequence sludge treatment plants, the cluster arrangement that we are experimenting with, we are putting 6 towns together. It has worked to a small degree, but again, we have challenges with that it creates long haulage distances. If you have to move across 4 or 5 towns to dump this waste, creates long haulage distances, which makes it more expensive and untenable. So there is need to have more such plants in almost every city. As I mentioned, the capacity to manage these facilities at the municipal level outside the city is still limited. And the private sector and the main utility, the National Sewage Corporation, are still hesitant to expand services in the small towns because the revenues are still small, the distances are a bit long. So it is a bit of still a challenge, but we are trying to encourage them to do more work in these areas. We are trying to document all these experiences and their roles and responsibilities into an improved fecal sludge management into the sanitation policy. which are working with the Ministry of Health of Uganda. And we believe that when this is well documented within the sanitation policy of Uganda, it can be able to clarify roles more and improve people's participation in vertical non-sewered sanitation. So with these experiences, our call to action really is that we should strengthen the local governments and the municipalities to take lead in inclusive sanitation. For example, the sanitation facility I put there. These are very basic sanitation, very basic facilities that can be managed at municipal level if we're able to build their capacities. All the data about on-site sanitation and everything, I think it is best managed, collected at the municipal local government level. So we should all of us strengthen their capacity to learn and implement more of this on-site sanitation. Although, unlike the large cities, for the small cities, support from the government, central government is still very critical because of the low economies of scale. This is something that cannot be run completely by private sector. So public support will still be required. And of course, if we can be able to put this all into an improved policy framework, then we can be able to sustain the services across all areas. So those, thank you very much. That is the experience from Uganda.
Thank you very much, Dr. Felix. Colleagues, like if you have any comments, queries, please use the chat function, and we will be taking that after the final presentation by Mr. Julio López. Mr. López will be talking in Spanish. So if you want to select, you can select the English channel. Now over to you, Mr. Julio López.
Good morning. For all those that are in the morning, good afternoon to all of you that are in the afternoon. I know that this is an international meeting, so the schedule is different. My name is Julio López. I'm the Director of Water and Sanitation of the Autonomous Municipal Government of Montero from Santa Cruz, from the Pluri-State National from Bolivia. And today we are here to talk about our sanitation project that we say that is sustainable given the results that we have. And we think that this is one of our solutions. And we hope really that this model can be replicated at a national level and maybe at an international level. So we can move to the next slide, please. Let's start with the data that we have here at a national level with the sanitation coverage. And as we can see in the area, in the rural areas, we are about 47%, and in the urban areas, we are talking about 75%, more or less. So on average, with the rural and urban area, it would be 69%. In my country, in my state, we can see in the Path City and also Cochabamba, our coverage is quite low in the rural area. It's quite typical in this region. And then the coverage increases in the urban areas such as Santa Cruz, Pando, and Chuquisaca and Tarija. The coverage in these different cities due to the growth that has been quite rapid. Apparently it seems quite high, but I must say that it's not like that. And they opted for other solutions with pit latrines, but they are not recognized by new registrations or new laws. And this resulted in one of the main problems in this city. Next slide, please. Within this context that I was mentioning, You can see here this map, and as you can see in the city of Montero, our coverage of the sewage coverage, it only covers the city center. And what does it mean? That 34% of the sewage coverage is operated by Esagomol, which is a cooperative from the private sector and is connected. And also we have another operator with EXA, and they have different networks in a population of almost 2,000 people. In the ecologic pit latrines that we are working, we are going to present an alternative solution with the sewage system, and we have 200 family health models that are already built, and this helps the families and the households, and this is our main project, and this is what we wanted to share with you. As mentioned before, the population is covered with a system that is based mainly in the pit latrine and sewerage system, but also we have other water systems and water facilities such as faucet tanks, and the faraway areas we have also latrines that it's only like a pit and they are used only by the families. And here they can collect all the fecal sludge. And this is covered maybe with a cloth or something like that. So there is not really sanitation. And the problem is that this situation made us think about a solution, because it can be a big problem in terms of pollution and hygiene measures. And it is crucial that every day, if we need to extract and collect and fetch that water, that fresh water for the population, we do it from the floor. So we are going down deep until 250 meters. And we have a big problem in terms of contamination.
And this is the model that we wanted to introduce to you. This is a project that we have developed with international strategic colleagues. It was very important to have the collaboration of international stakeholders in this project. And we've obtained very good results. We managed to bring this project to 6 big stakeholders in the international community. And we also have some strategical colleagues in an internal level, which is very important in order to develop this project and to carry out the analysis and all the evaluations for this project. We've had the collaboration of the State University, and this is a project inside the circular economy. And it's based on the dry ecological toilet. As well as on the laundry. We built this together with the state. They invested in this project during its first years, in the first phases of this project. When we say that this project has a closed cycle, we say that we use everything. We build these toilets, and then we have the people in charge of the transport that are also in charge of treating all the waste in order to make some compost, and then they use it for organic gardens. And we are also using it for a reforestation project in a municipal level, which is very important in here because we have very high temperatures. So we really need to plant these trees. And so we're moving forward together with UNICEF on how to treat these feces sludges. And we're doing some researches and some case studies in municipal gardens in which we produce vegetables and fruits. And with the help of other universities, such as the State University, they have been carrying out this analysis and giving us the results so we can really know which specific products we need for this compost. Regarding the laundry, all the waste is going to an organic garden, so we're not throwing anything. Everything is being reused. So this is our project, the project of the municipal government, with the collaboration of other international and national stakeholders, and it's giving very good results. These sanitation modules are being done in outskirts, and we hope that in less than maybe 20, 30 years, we'll reach to many more areas. We already see that it's been efficient, that it's working. So let's go to the next slide. So here are the main results of these projects. We can see that we already have 200 of these mosafas working in the district of Montero, where all the beneficiary families are operating, maintaining, and adopting the key hygiene practices. So the government aims to have a culture within the people that can really operate these. So in the future, they can really be aware of the importance of adopting these good practices. So Here we're talking about more than 7,000 children. And there's a shared responsibility towards the organization, the territorial organization of all these Mosafas or family health modules. We already have 12 plans of risk management and 2 green spaces that have been restored. Another important result is that we already have treatment plans that are operating. Also, we've implemented the school hygiene program. And we've had the Municipal Water and Sanitation Plan of Montero, which is the first one that we've had. And we really believe that this concept of having these toilets can be really reflected in schools so kids can really learn. We've carried out 7 studies for the cycle closure, and right now we are carrying out one that is very important in order to really establish what is the use of these and how we can obtain the best use of it. And we have a model and guide that has been approved by the government. And we have the cycle closure and use of fertilizer with research for replication in a national level. And another big result is that we obtained a partnership with 7 key sector donors in order to build a joint agenda and look for a solution. I'm sorry, Mr. López, we only have 1 minute to finish. Thank you. So one of the challenges is to overcome the economic gap to ensure the service is sustainable. And for that, we think that this is very important. And also that the sale of this compost is very efficient economically. Let's go to the next slide. Next slide, please. So we aim to develop a municipal sanitation plan. And this will be put in place together with other campaigns targeting children and their parents. And this will have also an impact towards the advocacy with municipal and neighborhood authorities. And here, we really want to say that it's been very important, the participation and the involvement of the MWE that have been really working together with us. So thank you very much. This was the last slide I was talking about. These are all the outcomes. And we've had this municipal plan that has become a very important tool. Then we have the advocacy campaigns in which we are involving not only strategic stakeholders, but also the people and the children. And then it's been very important to have these families involved in order to have the backup, this social backup of the communities. and really teach people how all of these benefits their own families, so they can live in a healthy way without diseases. And in the end, this has good benefits in all aspects of their lives. So thank you very much.
Thank you very much, Mr. Julio Lopez. And thank you very much, Antoinette Kome, Dr. Felix, and Julio for sharing your experiences. Time is not in our side. We have only 5 minutes based on our planned time. But Lava can use, if there are any questions, if we can take one question for each of the presenters.
Okay, so I have two questions, one for each. So first for Dr. Felix, what innovations are proving most impactful in your efforts to meet the challenges, technological, financial, policy, regulatory, capacity, behavior change? It's a very loaded question, but it's a big one. So what are those innovations? And then for Mr. López, the question for you is, what are the main factors for ensuring sustainability and scaling up of this excellent initiative? And there was a small clarification also on the acronym. Well, I'll find that in a second. So MOSAFA, if you can explain the acronym as well, that would be helpful.
Okay, thank you, Laura. If I can start, yeah, the question of what has been, I can just talk of only two examples. For example, if I say, I'd call it maybe, should I say, policy revision or policy reorientation, along with global sustainable development goals. When we say about this citywide inclusive sanitation, for me, I would call on the policy part, that is the biggest, most impactful discussion that has opened up doors and discussions. This non-sewer sanitation, as I mentioned, is the practice, is what has been going on. 90% of people are using this. But when you come to policy documentation, policy talk, there was the whole world, I mean, the country was silent on that. When you look at the water policy, you look at the national water sewage policy for utility, you look at everybody's policy, nobody was talking about non-sewer sanitation. But since over the last 7 years, when we talked about now that is inclusiveness for everybody, then it has caused a lot of impact that, the employers are coming out now, they are feeling strong, they are no longer an illegal people doing something shameful. They participate in meetings, in discussions, and everybody is now beginning to realize that, well, non-sewer sanitation is also something that can be done in a city, and it is really not is not problematic, and everybody is proud to do that. So I think that is a good initiative which we could be able to plan to all of it. And finally, this introduction of again, they are not really new, but they're just practices being introduced within the sanitation space. And this approach of, call center approach, this is also being used by the different private sector. But having a call center in a city that when I need emptying, I can call this number. I don't have to look for who are the emptiers, and then they can be able to coordinate and connect the different players. If you need any support on a mason to build a toilet, you can call the same call center and get a service coming to your way. I think it's a great initiative that is working both in the city and the small towns, and it makes access to services easier for the population. Thanks.
Thank you, Dr. Felix. Mr. López, if you can answer the query and also explain regarding MOFASA.
We clarified the acronym in the chat already, but the question, yeah. No, sorry, go ahead for the question.
Yes, if you want, I can answer. MOSAFA means Family Health Module, and it's a system that provides a solution of the sustainable sanitation compared to the traditional sewage. And on the other hand, how do we look for that sustainability? Well, as mentioned, we are using the MOSAFA, the family health models, and we are in the stability section of the process, and we are looking and checking how we can sell our compost in a more efficient manner so we can have a revenue or a higher revenue. And so this means that we have that demand and we want to make more profits out of these family health models so the Cosmo company can have more revenues, because this cooperative has like some taxes for their services, and we are expecting to build already 200 family health models, but we are expecting in total 3,000. So this is important for us in terms of economical sustainability and also environmental sustainability for us. I don't know if with this it's clear for you or if you would have any other questions.
Okay, thank you very much. There are other questions as well. It's such a complex issue, and let's continue the discussion. We know that there's so much has already been done, and there's still a long way to go. If you can bear with us for extra 5 minutes, we are already eating up than the planned time. Now, finally, I would like to request Andy Narracott, was sanitation specialist in UNICEF, in order to summarize the discussion and close the session. Over to you, Andy.
Thank you, Rajeev, and thank you, everyone. Very interesting case studies, both from a large urban centre and a smaller town, showing really different contexts. So thank you. Let's take a moment to reflect on what we heard. We've summarised that in 4 key takeaways as follows. So first and foremost, it's about moving away from isolated infrastructure-focused projects and instead embracing a comprehensive citywide approach that ensures continuity across all urban areas, including those informal areas, as mentioned by Dr. Felix, and not just sewerage and totally just just ignoring the fact that the majority of the city may be on non-sewer sanitation. As Antoinette highlighted as well, we continue to see substantial investments in urban sanitation infrastructure, large infrastructure, but often these systems are underutilized, they're poorly regulated, and they don't have the underlying systems to keep them functional. So urban sanitation is about is not working in silos, but taking a comprehensive approach, embedding within the broader urban planning framework and, including other services as well. So it's not just working in silos. Bolivia case study clearly demonstrated this with the development of a sanitation master plan, right? So linking city master plans supported by robust data on the actual situation on the ground, to really ensure those longer lasting outcomes for urban residents. The second one was about sanitation as a public good, and that requires strong government leadership. So in an urban context, this means making sure that all institutions know what their mandates are and their responsibilities, particularly when you have in an urban area, especially in a capital city where you might have the national institutions sitting alongside municipality authorities as well. So ensuring there's clear accountability for those who have the mandate and they are empowered to take decisions and deliver results. So this means supported by the right policy frameworks, making sure that all roles are clearly identified and clear, and all stakeholders know their responsibilities, and monitoring so they are held accountable for their performance. So without this, it obviously becomes very difficult to deliver citywide services, especially ensuring that those who are poor and underserved are delivered with services. The third takeaway is around coordination and collaboration. Again, this is about ensuring good coordination amongst all stakeholders, not just public and private, but also civil society, utilities, the communities themselves. We need to ensure that all of these different actors are held accountable, and that's either public institutions who are managing wastewater treatment plants or fecal sludge treatment plants, but also the private sector who may be transporting fecal sludge across the city. So ensuring that there is strong coordination and collaboration. Kampala, the KCCA highlighted this about the partnering with all national institutions, the private sector, the civil society. So this is really good to see. And let's not be fool ourselves. Clear coordination mechanisms are not easy, and they're not hard. They're difficult to establish, but they're absolutely essential in these sort of complex urban environments as well. And finally, we need to acknowledge the importance of having a skilled workforce and a capable workforce. Urban sanitation service delivery requires delivery of services across the full sanitation chain from containment to treatment, and that means properly trained professionals with the right, those institutions having the right capacity as well. There was a clear call to action from, I think it was one of the case studies. We must strengthen municipalities and local governments so they can lead the charge in delivering sustainable sanitation. So there you have it. Those are the 4 takeaways. We have comprehensive planning and citywide planning, strong leadership, clear mandates, and coordination amongst all stakeholders, and ensuring that we have the human resource with the right capacity and institutions with the right capacity to deliver those services. Next slide. Yeah, so here we have the final session in the series, which is so far on the 17th of June. And this is about that last takeaway about ensuring that we have the right capacity to deliver safely managed sanitation. Please sign up, use that QR code on the screen now. And I'm sure that in the chat as well. And I have the pleasure in closing this session, and thank you everyone for your participation and engagement today. We look very forward to continuing this important discussion on the steps to safely manage sanitation. So see you all next time.
Thank you. Thank you, everyone.
Thank you. Goodbye.
Thank you.